Hello students, welcome to Crack Derma with DrMSD. Myself Dr. Maddineni Srinivas, and this is the today's MCQ. 45-year-old female presented to the OPD with a unilateral painful red vesicular rash on the forehead and upper eyelid. Periorbital edema is present. You are able to see it is not crossing the midline. Okay, so this is, we can say, a dermatology and ophthalmology integrated MCQ, and if you have marked the answer as option D, herpes zoster ophthalmicus, excellent, 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 you are absolutely correct. So one question for all of you: there is a named sign associated with this condition, herpes zoster ophthalmicus, where if the tip of the nose has vesicular lesions, then most likely cornea will also get affected. If you know the answer for this named sign, leave it in the comments below. Few points about this herpes zoster. The causative virus is varicella zoster virus, which lies dormant in the dorsal root ganglion, and when it gets reactivated, it is going to produce multiple vesicular lesions along a dermatome, or we can say here unilateral or segmental. These are the words which will be given in the question. So in this way, the patient is going to present, and these lesions are going to be extremely painful. There will be erythematous base. Okay. Thank you so much. I hope these videos are very helpful. Please do like this video and do follow Cerebellum Academy and Crack Derma with DrMSD for more such awesome content on a daily basis. Thank you so much.